Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Dermatologics. I'm Paul Winnington, Editorial Director for Practical Dermatology magazine. The first patient has been dosed in Sienna Biopharmaceuticals' Phase 1-2 Proof of Concept clinical trial of topical product candidate SNA-125 for the treatment of atopic dermatitis and associated pruritus. SNA-125 is designed to inhibit Janus kinase 3 or JAK3 and tropomyosin receptor kinase A with minimal to no systemic exposure. JAK3 is a validated target in atopic dermatitis, psoriasis, and pruritus. JAK3 is required for immune cell development, and inhibiting JAK3 blocks the signaling of key cytokines such as interleukin-4 or IL-4, IL-2, and tumor necrosis factor alpha, which results in a reduction in the severity of autoimmune and inflammatory diseases in which those cytokines play a pivotal role. TRKA is the high-affinity receptor for nerve growth factor, a known mediator of neurogenic inflammation and itch. This multicenter, randomized, double-blind, placebo- and comparator-controlled intra-individual trial will evaluate the safety, tolerability, and efficacy of SNA-125 compared to vehicle and other reference formulations in approximately 30 patients with atopic dermatitis. As the popularity of biotin has grown, so has the incidence of this vitamin interfering with critical medical tests. Now, a review in the Journal of Applied Laboratory Medicine provides expert recommendations on how to reduce biotin interference with test results. Biotin is a key ingredient in the immunoassay that labs use to detect a broad range of conditions, from heart attacks and prostate cancer to thyroid disease and pregnancy. If a patient takes biotin supplements, the biotin in his or her blood sample competes with the biotin used in immunoassays and can falsely increase or decrease results of the test. In the review, clinical laboratory experts from the University of Washington in Seattle outline major steps clinicians and labs should take to minimize the impact of biotin interference on patient care. Ideally, all healthcare providers should ask patients if they are taking biotin supplements and report this to the lab when ordering tests. Thank you for listening to DermWire News, powered by DermWire.com. This editorially independent program is supported with advertising from Dermatologics.